Hello viewers. How are you? This is Rishi. In this video today we are talking about an illness that is important to many people. Subscribe to us and stay with us. Okay, then let's talk about it. Atopic dermatitis or eczema is a condition that makes your skin red and itchy. It's common in children, but can occur at any age. Atopic dermatitis is long-lasting and tends to flare periodically. It may be accompanied by asthma or hay fever. No cure has been found for atopic dermatitis. But treatments and self-care measures can relieve itching and prevent new outbreaks. For example, it helps to avoid harsh soaps, moisturize your skin regularly, and apply medicated creams or ointments. Atopic dermatitis signs and symptoms vary widely from person to person and include itching, which may be severe, especially at night. Dry skin. Small, raised bumps, which may leak fluid and crust over when scratched. Red to brownish gray patches, especially on the hands, feet, ankles, wrists, neck, upper chest, eyelids, inside the bend of the elbows and knees, and in infants, the face and scalp. Raw, sensitive, swollen skin from scratching. Thickened, cracked, scaly skin. Atopic dermatitis most often begins before age 5 and may persist into adolescence and adulthood. For some people, it flares periodically and then clears up for a time, even for several years. Healthy skin helps retain moisture and protects you from bacteria, irritants, and allergens. Eczema is related to a gene variation that affects the skin's ability to provide this protection. This allows your skin to be affected by environmental factors, irritants, and allergens. In some children, food allergies may play a role in causing eczema. The primary risk factor for atopic dermatitis is having a personal or family history of eczema, allergies, hay fever, or asthma. Complications of atopic dermatitis may include irritant hand dermatitis. This especially affects people whose work requires that their hands are often wet and exposed to harsh soaps, detergents, and disinfectants. Asthma and hay fever. Eczema sometimes precedes these conditions. More than half of young children with atopic dermatitis develop asthma and hay fever by age 13. Skin infections. Repeated scratching that breaks the skin can cause open sores and cracks. These increase the risk of infection from bacteria and viruses, including the herpes simplex virus. Chronic itchy, scaly skin. A skin condition called neurodermatitis starts with a patch of itchy skin. You scratch the area, which makes it even itchier. Eventually, you may scratch simply out of habit. This condition can cause the affected skin to become discolored, thick, and leathery. Sleep problems. The itch-scratch cycle can cause poor sleep quality. Allergic contact dermatitis. This condition is common in people with atopic dermatitis. Tips that we are talking about now may help prevent bouts of dermatitis and minimize the drying effects of bathing. Moisturize your skin at least twice a day. Creams, ointments, and lotions seal in moisture. Choose a product or products that work well for you. Using petroleum jelly on your baby's skin may help prevent the development of atopic dermatitis. Try to identify and avoid triggers that worsen the condition. Things that can worsen the skin reaction include sweat, stress, obesity, soaps, detergents, dust, and pollen. Reduce your exposure to your triggers. Infants and children may experience flares from eating certain foods, including eggs, milk, soy, and wheat. Talk with your child's doctor about identifying potential food allergies. Take shorter baths or showers. Limit your baths and showers to 10 to 15 minutes. And use warm, rather than hot, water. Take a bleach bath. The American Academy of Dermatology recommends considering a bleach bath to help prevent flares. A diluted bleach bath decreases bacteria on the skin and related infections. Add 1/2 cup 118 milliliters of household bleach, not concentrated bleach, to a 40-gallon, 151-liter bathtub filled with warm water. Measures are for a U.S. standard-sized tub filled to overflow drainage holes. Soak from the neck down or just the affected areas of skin for about 10 minutes. Do not submerge the head. Take a bleach bath no more than twice a week. Use only gentle soaps. Choose mild soaps. Deodorant soaps and antibacterial soaps can remove more natural oils and dry your skin. Dry yourself carefully. After bathing, gently pat your skin dry with a soft towel and apply moisturizer while your skin is still damp. No lab test is needed to identify atopic dermatitis. Your doctor will likely make a diagnosis by examining your skin and reviewing your medical history. He or she may also use patch testing or other tests to rule out other skin diseases or identify conditions that accompany your eczema. If you suspect a certain food caused your child's rash, tell the doctor and ask about identifying potential food allergies. Atopic dermatitis can be persistent. You may need to try various treatments over months or years to control it. And even if treatment is successful, signs and symptoms may return. It's important to recognize the condition early so that you can start treatment. If regular moisturizing and other self-care steps don't help, your doctor may suggest one or more of these treatments. Creams that control itching and help repair the skin. Your doctor may prescribe a corticosteroid cream or ointment. Apply it as directed, after you moisturize. Overuse of this drug may cause side effects, including thinning skin. Other creams containing drugs called calcineurin inhibitors, such as tacrolimus, Protopic, and pimecrolimus, Elidol, affect your immune system. They are used by people older than age 2 to help control the skin reaction. Apply it as directed, after you moisturize. Avoid strong sunlight when using these products. These drugs have a black box warning about a potential risk of cancer. But the American Academy of Allergy, Asthma and Immunology has concluded that the risk-to-benefit ratios of topical pimecrolimus and tacrolimus are similar to those of most other conventional treatments of persistent eczema, and that the data don't support the use of the black box warning. Drugs to fight infection. Your doctor may prescribe an antibiotic cream if your skin has a bacterial infection, an open sore, or cracks. He or she may recommend taking oral antibiotics for a short time to treat an infection. A newer option for severe eczema. The Food and Drug Administration, FDA, has recently approved a new, injectable biologic monoclonal antibody called dupilumab, Dupixent. It is used to treat people with severe diseases who do not respond well to other treatment options. This is a newer medication, so it doesn't have a long track record in terms of how well it helps people. Studies have shown it to be safe if used as directed. It is very expensive. Oral drugs that control inflammation. For more severe cases, your doctor may prescribe oral corticosteroids, such as prednisone. These drugs are effective but can't be used long-term because of potentially serious side effects. Let's talk what are the therapies. Light therapy. This treatment is used for people who either don't get better with topical treatments or who rapidly flare again after treatment. The simplest form of light therapy, phototherapy, involves exposing the skin to controlled amounts of natural sunlight. Other forms use artificial ultraviolet A, UVA, and narrowband ultraviolet B, UV, either alone or with medications. Wet dressings. Effective, intensive treatment for severe atopic dermatitis involves wrapping the affected area with topical corticosteroids and wet bandages. Sometimes this is done in a hospital for people with widespread lesions, because it's labor-intensive and requires nursing expertise. Or, ask your doctor about learning how to do this technique at home. Counseling. Talking with a therapist or other counselor may help people who are embarrassed or frustrated by their skin condition. Relaxation, behavior modification, and biofeedback. These approaches may help people who scratch habitually. Though effective, long-term light therapy has harmful effects, including premature skin aging and an increased risk of skin cancer. For these reasons, phototherapy is less commonly used in young children and not given to infants. Talk with your doctor about the pros and cons of light therapy. Treatment for eczema in babies. Infantile eczema includes identifying and avoiding skin irritants, avoiding extreme temperatures, lubricating your baby's skin with bath oils, creams, or ointments. See your baby's doctor if these measures don't improve the rash or if the rash looks infected. Your baby may need a prescription medication to control the rash or to treat an infection. Your doctor may also recommend an oral antihistamine to help lessen the itch and to cause drowsiness, which may be helpful for nighttime itching and discomfort. To help reduce itching and soothe inflamed skin, try these self-care measures. Apply an anti-itch cream to the affected area. A non-prescription hydrocortisone cream, containing at least 1% hydrocortisone, can temporarily relieve the itch. Apply it no more than twice a day to the affected area, after moisturizing. Using the moisturizer first helps the medicated cream penetrate the skin better. Once your reaction has improved, you may use this type of cream less often to prevent flare-ups. Moisturize your skin at least twice a day. Find a product or combination of products that work for you. You might try bath oils, creams, ointments, or sprays. For a child, the twice-a-day regimen might be an ointment before bedtime and a cream before school. Ointments are greasier and sting less when applied. Take an oral allergy or anti-itch medication. Options include non-prescription allergy medicines, antihistamines, such as Tyrosine, Zyrtec, or Fexofenadine, Allegra. Also, diphenhydramine, Benadryl, others may be helpful if itching is severe. But it causes drowsiness, so it's better for bedtime. Apply an anti-itch cream to the affected area. A non-prescription hydrocortisone cream, containing at least 1% hydrocortisone, can temporarily relieve the itch. Apply it no more than twice a day to the affected area, after moisturizing. Using the moisturizer first helps the medicated cream penetrate the skin better. Once your reaction has improved, you may use this type of cream less often to prevent flare-ups. Take a warm bath. Sprinkle the bath water with baking soda, uncooked oatmeal, or colloidal oatmeal, a finely ground oatmeal that is made for the bathtub, Aveeno, others. Soak for 10 to 15 minutes, then pat dry. Apply moisturizer while the skin is still damp. Don't scratch. Rather than scratching when you itch, try pressing on the skin. Cover the itchy area if you can't keep from scratching it. For children, it might help to trim their nails and have them wear gloves at night. Apply bandages. Covering the affected area with bandages helps protect the skin and prevent scratching. Choose mild soaps without dyes or perfumes. Use soap that's super fatted and non-alkaline. Be sure to rinse off the soap completely. Use a humidifier. Hot, dry indoor air can parch sensitive skin and worsen itching and flaking. A portable home humidifier or one attached to your furnace adds moisture to the air inside your home. Wear cool, smooth textured clothing. Reduce irritation by avoiding clothing that's rough, tight, or scratchy. Also, wear appropriate clothing in hot weather or during exercise to prevent excessive sweating. Treat stress and anxiety. Stress and other emotional disorders can worsen atopic dermatitis. Acknowledging those and trying to improve your emotional health can help. Atopic dermatitis can be especially stressful, frustrating, or embarrassing for adolescents and young adults. It can disrupt their sleep and even lead to depression. And close family members of people with this condition may face financial, social, and emotional problems. Seek psychological support from counselors, support groups, friends, or family. List your signs and symptoms, when they occurred, and how long they lasted. Also, it may help to list factors that triggered or worsened your symptoms, such as soaps or detergents, tobacco smoke, sweating, or long, hot showers. Make a list of all the medications, vitamins, supplements and herbs you're taking. Even better, take the original bottles and a written list of the dosages and directions. List questions to ask your doctor. Ask questions when you want something clarified. So, if you think the video is worthwhile, please like and share it with someone else. Also, subscribe to our channel and stay connected. We are constantly educating you about diseases and your health. Thanks for watching. See you again with another important topic.